There are few places more high risk than Canada's many long-term care homes. More than half the country's deaths linked to COVID-19 occurred in places like this. Most in an outbreak at this BC home, prompting several provinces to lock down facilities, ban visitors, and extra staff paid for by families.
I am not permitted to go in to see my husband. I'm sorry.
People like Margaret Calver worry there just aren't enough staff to properly care for residents like her husband Wayne, who lives on the same floor as someone who tested positive for COVID. She says in regular times there can be just 2 staffers to care for 21 people. Do you have worries about how effectively you can isolate people on a dementia ward, people who may be prone to wandering, how effectively you can do that with just 2 staff?
Almost impossible. The residents wander in and out of each other's rooms. There are interactions between residents, sometimes quite negative with behavior issues. So I'm not sure how they're going to keep the residents in their rooms.
The home says the best possible protocols are in place to protect our residents, and there are efforts to redirect community resources to the home. To limit potential exposure to the virus inside homes, families and private caregivers have been banned. But the effect, many worry, will be chaos inside homes.
The issue with wandering residents having lockdown units where there aren't enough staff on in order to help quarantine these individuals, you can't lock somebody in their rooms, especially when they have dementia.
The province is racing now to bring in more staff. Care homes, after all, are where risk and need are among the highest. David Common, CBC News, Toronto.